The graduation address gives us the opportunity to hear from a distinguished member of our alumni community, and we're really fortunate today that the address will be delivered by Associate Professor Philip Russo. Associate Professor Russo is the Director of Nursing Research at Cabrini Health and an Associate Professor in the Faculty of Medicine, Nursing and Health Sciences. Associate Professor Russo recently led the Australian National Healthcare Associate Infection Point Prevalence Study, the first in Australia for 34 years, and he's currently the President of the Australasian College for the Infection Prevention and Control, which is the peak body for infection prevention and control professionals in the Australasian region. He's the recipient of a National Health and Medical Research Early Career Fellowship and has attracted research funding from government, industry and academic sources. Associate Professor Russo holds a Bachelor of Nursing from Deakin University, a Master of Clinical Epidemiology from Monash University and a Doctor of Philosophy from the Queensland University of Technology. It now gives me great pleasure in inviting Associate Professor Philip Russo to deliver the graduation address.
Thank you. I would like to take this opportunity to acknowledge the people of the Kulin Nations on whose land we are gathered today. I pay my respects to their elders, past and present. Deputy Chancellor, the Honourable Simon Crean, Pro Vice-Chancellor Academic, Professor Chris Ryan, Associate Dean Research and Research Infrastructure of the Faculty of Medicine, Nursing and Health Sciences, Professor Ian Smythe, members of the faculty, ladies and gentlemen, and of course, a hearty welcome and congratulations to the new graduates. It is an honour to be standing here before you today. In thinking about what I would share with you, I looked back over my CV and counted 9 distinctly different jobs I have held since graduating as a nurse. They've all had their pros and cons, and I've been fortunate to have worked with people who have left me in awe, and that still happens. But I thought I would share with you 2 periods in my career that, if I retired right now, would be called the bookends of my career, but they also have another connection that will become apparent. So I want to take you back to 1983. Bob Hawke was our Prime Minister, Men at Work released Down Under, and Australia too had just won the America's Cup. This was when I commenced my nurse training at the Alfred Hospital. Having tried teaching at the old Rusden College just across the road here, I realised my interest was in health, and watching my sister, who was a nurse, work AM shifts and PM shifts and then string 5 days off together and go camping seemed like a pretty good life to me. I could have also applied to commence the Graduate Diploma of Applied Science in Nursing at the Lincoln Institute, but the lure of a salary was too tempting for me at the time. Of course, back then there was much debate about whether hospital-trained or university-educated nurses were better. I did my best to mediate between the two views by eventually dating an educated nurse, and it just so happens we celebrate our 30th wedding anniversary this weekend. Coinciding with my nurse training was the onset of AIDS in Australia, which was putting fear into our community, fuelled by uncertainty and misinformation about transmission modes and accompanied by discrimination against the communities that were affected most. This aside, I must admit I was intrigued by the notion of outbreaks and epidemics, modes of transmission and prevention. I graduated in October 1986 in the middle of the nurses' strike, and not long after found myself working on the infectious diseases ward at Alfred Hospital. Although the first AIDS diagnosis in Australia was made in 1982, HIV diagnoses peaked in 1987, and it was from around this time I worked permanently on the infectious diseases ward, and the subsequent years remain etched in my memory. The infectious diseases unit at the Alfred was a small 9-bed unit used to accommodate inpatients who were infected with various organisms, often nothing too dramatic, but required isolation from other patients. But suddenly the unit was becoming overwhelmed by normally fit men, often with devastating opportunistic infections. Many who have had no previous medical issues, but here they were suddenly very sick, and you could literally see the fear in their eyes. Blood tests were taken, and the ensuing 24 to 48 hours waiting for a result was an excruciating period for them. At that time, a diagnosis of AIDS was often associated with a prognosis of just several months. As a healthcare worker, there were many challenges. A common issue was secrecy around the sexuality of the patient. Keep in mind, this is some 35 years ago. Being gay or engaging in same-sex relationships is not something that was usually discussed, acknowledged, and certainly not accepted by many. So we would have many patients telling us their stories that they had never told anyone before. For many, the revelation that the reason their child, sibling, partner, friend was in hospital was because they had AIDS, and the connotations that came with it was just too much to bear. To avoid such distress, some patients told their families they had developed a rare form of cancer. And so respectfully, every day, the healthcare workers would need to confirm with the patients any updates on the information they may have shared with their family. Although it was a grim time, there were also many good times as well. I vividly recall a patient who I will call Shane. Shane was a drag queen who regularly performed shows in St Kilda. Shane was a lively, friendly and hilarious character who kept us all entertained with jokes, costumes and the occasional song and dance routine on the ward. But before long, Shane became very sick, and the powerful but largely experimental drugs of the day often made her confused. I recall one night duty when she became quite confused and started to let loose with some colourful language. I thought it best if I sat with her for a while to help settle her down. And I remember thinking to myself at that time, it's 2 o'clock in the morning, I'm sitting in a dark room with a confused and swearing drag queen who is dying from AIDS. It's a moment that has stayed with me. Sadly, pretty soon she passed away, surrounded by her eclectic group of friends. Unfortunately, this was often the way things went. But of course, there are always positives, and I have many fond memories of this time. We witnessed countless families and friends supporting their loved ones to a peaceful death. The gratefulness to the healthcare team for providing care without fear or favour was always touching. As a healthcare worker, it is a true privilege to be brought into people's lives at such critical times. Working in these intense environments also brings you closer to your colleagues, regardless of our specialty, be it nursing, medicine, allied health, pastoral, whatever. We valued each other's support. We weren't just work colleagues, we were also friends, and many of those friendships continue today. During this time, I obtained my Bachelor of Nursing because I knew my old nursing certificate was quickly becoming outmoded and, importantly, would limit my opportunities for further education. Not long after, I went on to complete a Master's in Clinical Epidemiology. And these qualifications opened up more doors for me, and although admittedly I wasn't so sure about some of the jobs, I tried to take every opportunity that came my way. Through the 90s and 2000s, I worked in infection prevention and control roles at a number of hospitals in Melbourne and also at a state and national level. These positions provided me with the opportunity to meet and work with many wonderful healthcare workers from a variety of settings. I'm so fortunate and grateful that my work has taken me all around Australia and overseas. And at one stage, I found myself presenting at a meeting at the World Health Organization in Geneva. But let's fast forward to the current bookend of my job today, and I have no doubt this chapter may well go on for some time. Of course, I'm talking about the COVID pandemic. I thought I was reasonably well equipped and knowledgeable in the prevention of infectious diseases. I even made a regretful quip at the start of last year that all of us who work in this field love a good outbreak. I was very wrong. At this mature stage of my career, I can tell you that I have learnt more in the past 12 months than all the preceding years. I'm not just talking about infection prevention and control. I'm also talking about human behaviour, collegiality, dedication, humanity, and of course, politics. I commenced my role at Monash in February 2019, and in November of that year, 3 months prior to the WHO declaring a pandemic, I was elected to the position of President of the Australasian College for Infection Prevention and Control, and I certainly didn't predict what was ahead. Over the past 18 months, I've been involved in advising Commonwealth and state governments. I've investigated outbreaks in hospitals, aged care settings and quarantine hotels. I've had the privilege of working alongside government department heads, chief health and medical officers, and of course, many dedicated, committed healthcare workers. And I'm very proud to say that I was a member of the Monash nursing and midwifery team that delivered an education program on PPE use to residential and aged care facilities across Victoria. This was an intense program of work headed up by the head of school, Professor Deborah Griffiths, that came together over a few days in a rapid response to address a desperate need in our aged care facilities. And in fact, the team were one of 3 finalists of the recent HESTA Australian Nursing and Midwifery Awards. I can't yet adequately describe what the past 18 months have been like. We are all living in an extraordinary time with our own very personal and unique experiences. But I can share briefly some of my observations. I've seen dedicated people from all backgrounds working well beyond the call of duty. I know of healthcare workers who have had to step away from their work because of exhaustion. I've had to challenge colleagues, friends and family to dispel rumours and myths generated by the ill-informed. I've been amazed at the speed of how vaccines can be developed when there are dedicated resources. And in a never-seen-before attempt to provide accurate guidance, Australia's National COVID-19 Evidence Task Force has been resourced to undertake continuous surveillance of the literature to ensure our recommendations and guidelines are updated as new evidence comes to the fore. And yet there is still so much to do. As we've seen in Victoria in the past few days, we need to be prepared for change and uncertainty. So in finishing up, I will share a question a mentor once posed to me. At the end of the workday, he would often ask us, "What have you learnt today?" On one occasion, I had trouble thinking of a response. After a pause, he then asked, "Well, if you are not learning, what are you doing?" This question continues to inspire me to make the most of opportunities to learn and grow. But of course, my problem now is trying to remember what I've learnt. To the graduates, you have prepared yourselves well for your futures by graduating from Monash. Your education is the envy of many, and I'm sure I'm not the first person to say to you, this exciting moment is just the beginning. My career started during a global epidemic. Many of you are starting your careers in a pandemic. It is truly an extraordinary time to be a healthcare worker. My offerings to you are simple. Keep learning, stay agile and open-minded, be kind and be thankful to those around you. Congratulations, graduates. Enjoy today, tonight and the future.
Thank you very much, Professor Russo, and I think highlighting the context that we all live in today, the importance of your profession as you go forward. There will always be challenges, and in the motto of this university, it is an exercise in continuing to learn and continuing to be challenged. So, thank you for those inspiring words, and I'm sure that they will be taken on board in the positive way that you've encouraged them to be.